My name is Dr. Yolanda Turley. I'm a family physician in Ottawa. I practice full-scope family medicine with a special interest in women's health and prenatal and obstetrical care. I see lots of women of all ages in my practice, and I perform a lot of pelvic exams, including a lot of Pap smears. A Pap smear is a test where a small sample of cells is taken from the cervix. The cervix is the lower part of the uterus, the part that sits deep inside the vagina. There is a sexually transmitted virus called human papillomavirus, or HPV for short, and being infected with this virus increases your risk of developing cancer of the cervix. This virus is very common, and it can sometimes cause changes to the cells of the cervix. If left unchecked or untreated for a long time, these changes to the cells can sometimes turn into cancer. So the reason for doing a Pap smear is to take a small sample of the cells from the cervix to see if there are any changes which could be precancerous and are caused by HPV. Women themselves often don't know that they might have these changes to the cells of the cervix, as it gives no pain, no bleeding, and no other symptoms. So you can be completely well, but still have a precancerous condition that you are unaware of. Because changes of the cervix are caused by a sexually transmitted virus, we only have to do Pap smears on women who have ever been sexually active, and only after the age of 21 or 25, depending on which province you live in. If you are a virgin, you do not need to have a Pap smear, regardless of your age. As well, we no longer do Pap smears after the age of 69, as the chances of cancer of the cervix are extremely low later on in life. The Pap smear itself is part of doing a pelvic exam. You may feel somewhat awkward in this position, but rest assured that medical professionals do many of these kinds of exams, and we will make you feel as comfortable as possible during this test. You should have a drape over your lower abdomen, and the exam should take place in a private area without interruptions. For the provider to be able to see the cervix, they have to insert a small device called a speculum. This is made either out of metal or plastic, and it looks like this. The speculum goes into the vagina and is then opened to look at the cervix. We use some lubricant to insert the speculum, and we use the right size for the patient that we are examining. The insertion of the speculum should not be painful, but it might feel a bit uncomfortable as it causes a feeling of pressure inside the vagina. If you feel like it is hurting you or causing you too much anxiety, you can always ask the person doing the test to stop. We do not want to make this into a traumatic experience. But in truth, most women who have never had a Pap smear worry about it and then find that it's not way as bad as they thought it was going to be. We use a small brush which goes into a small bottle of liquid. The brush touches the cervix and the cells stick to it as we gently rotate the brush 5 times, a little bit like this. At the same time as doing the Pap smear, we can also test for sexually transmitted infections such as chlamydia and gonorrhea. The provider might ask you if you want to be tested for these. If you receive an abnormal result, please don't panic. The good thing about doing regular Pap smears is that we are catching changes to the cells at a very early stage, and this means that it can be treated very well. The other important thing to know is that your body can often heal up the changes caused by HPV, so sometimes we take a wait-and-see approach to changes that we find. It is very safe and appropriate to wait for 6 months and recheck you with another Pap smear to see if your body has healed up on its own. In this case, you don't need any special procedures or treatments, and you will simply be monitored more closely for a few years. If the changes are more serious, your provider would refer you to a gynecologist or a nurse practitioner who has been trained to do a procedure called colposcopy. At this time, we recommend doing a Pap smear every 3 years, unless you are in a high-risk group who needs them more often. Your provider would let you know if that is the case. The other thing we recommend is getting immunized against HPV. There's a very good vaccine available in Canada, and most people will be offered this vaccine in high school. It protects very well against HPV, but it is important to know that even after the vaccine, we still recommend doing Pap smears every 3 years. I hope that this video has been very helpful in explaining the details of a Pap smear. And please don't be nervous. It's a simple and fast test that is really not as bad as many people think. Thank you.